I received this grant in a very crucial moment in my career. I started a new lab, I moved to a new institution, and of course there are multiple effects of such an award. One is you personally, you gain self-confidence and you see that you can compete, and of course you start to compete at the levels that is more fair, and then, you know, it really gives you a lift. But this is the one, but really more pragmatic issue is that these grants absolutely help to initiate new projects that could not have been started because there is just no funds for them. They are probably, of all funding mechanisms, these grants have this magnifying effect that when you are able to commit a certain funds and a certain amount of time to a particular project, you can make it better and then amplify it by obtaining secondary finding later on, because you generated more evidence and you generated more preliminary results, which would help you then to further to apply to other agencies, etc. So there is this augmenting effect of these grants that might fund areas of research that otherwise would have not been pursued. In part, thanks to the funding from your foundation, the research topics, the targets of the investigations have evolved over the years, and more we became more pragmatic, I like to think more mature in what we do, because I think that if you compare the research questions that we tried to answer 10 years ago and now, we became more pragmatic and more disease-focused, more patient-focused. Ultimately, while it is important to investigate the pathogenesis of these diseases and mechanisms, the ultimate goal is to improve patient care, and, you know, with a very ultimate goal of cure. The research meetings that we conducted on biannual basis usually in Washington, D.C., the idea for it was based on the funding mechanisms that is provided by various institutes from NIH. So National Heart, Lung and Blood Institute, but also National Cancer Institutes and other entities within the NIH, as well as commercial sponsors. So we came up with this idea and we applied and were successful obtaining the initial funding for this. And then subsequently this grant has been reapplied for each of the subsequent meetings. It's very important to start somewhere, and this is a wonderful source of funding with very relevant questions, a very caring group of people who administer these grants. So the review is very academic and I believe provides quality assessments of the applications, and therefore obtaining funding through this mechanism should be considered a major success and milestone in the scientific career. What is most important, I think, that has to be said in the conjunction of aplastic anemia and MDS International Foundation funding mechanisms is the tremendous gratitude and thanks to all those who contributed to make these research grants possible. I cannot express how important it is that we have this support in patients or people who one way or the other were involved in or were affected by these diseases through through their relatives or just because they knew somebody who had the disease. And I just think that this is an incredible gift of hearts, and and it's difficult to really reciprocate in any ways, in some way, just to make it. I think the best way to say thank you is to make progress and to work hard and to really strive to use the funds as judicious as possible.